righty, good morning. Welcome to the town meeting program. As promised, we're going to spend some time today going over the latest information we received from a number of local and state sources. Going over the latest COVID-19 information. Want to offer a quick word of thanks first to Cordova Wireless Communications, which sponsors this program, your town meeting program. Cordova Wireless, of course, your local cell phone provider providing your local talk program. And like we say, quite a bit to get to. It's going to be a lot of words, but hope you'll do all right keeping up with it. And we hope to also have this program, in case you miss it or hear of somebody who missed it and would like to hear it later, we're going to, I think, put it on our Cordova TV YouTube channel. There won't be any video to go with it, of course. It'll be audio, but like we said, we hope to have that up there for you. And I kind of want to start here by acknowledging how well our local folks in emergency preparedness, the Cordova Prepared Group, are doing, assembling and getting information out that's relevant to us here locally. There are joint statements coming out with the city, with the Cordova Prepared. These are the emergency preparedness folks. Also the Yolonka Community Health Center and the Cordova Community Medical Center. Rather than trying to, everybody trying to do their own thing, they're really coordinating and making sure that their information is in sync. And, of course, that's always been one of the things that we seem to do so much better than many other communities. I remember one of the first meetings that I went to after we took over the stations back in the early 90s was going to a providers meeting and seeing all these local agencies that wanted to make sure they didn't duplicate their efforts and waste a bunch of time and resources, everybody doing the same thing. So they'd get together and make sure that people who needed a particular type of help were going to the right place. They would refer people to each other, and it's just, we're very good at that. And I like to see that continuing with our emergency services folks. So again, we're going to go over the latest here as of Monday, March 16th, and we'll actually start at the state level as the state of Alaska continues to put out health alerts, I think pretty much on a daily basis here, and this is the one that came out yesterday on Sunday the 15th. The Department of Health and Social Services is strongly advising that all Alaskans comply with this guidance for returning travelers. Under the category of higher risk, if a traveler is returning within 14 days from the time you left an area with any widespread ongoing issues, particularly Europe and China, the state is asking that when you get back that you stay home and avoid contact with any other household members, and also contact your employer and don't go to work or school during this 14-day period after you return. So that's for people that go, say, if you're coming back from China, Iran, South Korea, places in Europe, Italy, and so forth that have been having particular trouble with these things. Now, if a traveler is returning that is considered medium risk, just in generally, that means people coming back to Alaska from outside. What the state's asking is that you discuss your work situation with your employer before returning to work, minimize contact with people as much as possible, self-monitor, practice social distancing, and we're going to talk a little bit more about recommendations for social distancing, what that means, and so forth a little later. And then they say if you're in this medium risk group, it may mean not going to work or school if you can't safely be distanced from others, especially if you traveled to a location where any community transmission is occurring. So those are some guidelines for basically anybody coming back to Alaska. Now, they're also offering some updated health guidance for returning travelers in both the higher and medium risk group. The suggestions are that these folks take their temperature with a thermometer 2 times a day and monitor for fever. Also watch for cough or trouble breathing. Don't use mass transportation. We don't really have to worry about that, but mass transportation should be avoided during your time period that you're practicing social distancing. Avoid crowded places, shopping centers, movies, that kind of thing. Limit your activities in public. Try to keep your distance from others. About 6 feet is the recommendation. If you get sick with a fever of 100.3, or you have cough, shortness of breath, those kinds of symptoms, call your health provider. Don't just go in, but call a health provider. And if you need medical care for other reasons like dialysis or other such serious procedures, go ahead to your doctor and just be sure to tell them about your recent travel. And then the state in this announcement reminded everybody again to follow the previous guidance about regular hand washing, cleaning surfaces, and avoiding large gatherings. And on the subject of large gatherings, actually, we'll jump to the national stage for just a sec here, because a fairly significant national guidance came out yesterday as well on Sunday. And it says large events and mass gatherings can contribute to the spread of COVID-19 in the United States via travelers who attend big events and introduce the virus to new communities. Examples of large events and mass gatherings include conferences, festivals, parades, concerts, sporting events, weddings, and other types of assemblies. These events can be planned not only by organizations and communities, but also by individuals. Therefore, the CDC, in accordance with its guidance for large events and mass gatherings, recommends that for the next 8 weeks, organizers, whether groups or individuals, cancel or postpone in-person events that consist of 50 people or more throughout the entire country. Events of any size should only be continued if they can be carried out with adherence to guidelines for protecting vulnerable populations, for hand hygiene, and for social distancing. When feasible, organizers should modify the events to be virtual. Can you live stream it? That kind of a thing. So again, that's a national recommendation that for the next 8 weeks, any event with 50 or more people is recommended for cancellation across the country. Now, they do emphasize this recommendation doesn't apply to the day-to-day operations of organizations like schools, institutes of higher learning, or businesses. It's a recommendation made in an attempt to reduce introduction of the virus into new communities and slow the spread of infection in communities already affected. And then they conclude this announcement with something that's important for us here. This recommendation is not intended to supersede the advice of local public health officials. It's a guideline. It's not a mandate. It's not a quarantine. It's a suggestion. The CDC considers this wise, but they emphasize deferring to local authorities. And so we will, continue to pass that along as the information comes. Now, again, what we're doing on this edition of the Town Meeting program here today on Monday the 16th is going over all the documentation we've accumulated recently from primarily our local public safety folks, along with some state and national resources. And we want to get into the pile here now from this group of local experts, the Cordova Community Medical Center, Alanka Community Health Center, City of Cordova, and the Cordova Prepared Group. And in this document, they say, while there are no identified cases of COVID-19 in Cordova, we want to ensure our elder and senior population remains safe and healthy. All your local healthcare facilities, first responders, and the City of Cordova have been closely monitoring and preparing for the possibility of COVID-19 showing up. They emphasize here now that you seek medical attention immediately if you have difficulty breathing, but please call ahead to notify the hospital that you are coming. And what that helps with, obviously, is for them to make preparations to assist you without having anything spread. Symptoms of COVID-19 listed by our local folks, the symptoms of concern are cough, persistent fever that remains at 100.4 degrees or higher, and shortness of breath. They recommend the same steps to protect against coronavirus as we take to prevent the spread of the common cold or flu, namely, wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, an alcohol-based hand sanitizer, and the general recommendation on that is 60% or more alcohol. They recommend avoiding close contact with people who are sick with any type of illness. Avoid crowds of 10 people or larger. Avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with a tissue that is then thrown in the trash. And if you don't have a tissue, try to use your elbow. Just don't cough or sneeze into your hands. They say clean and disinfect touched objects and surfaces using a regular household cleaning spray or wipe. If you have not received your annual flu shot, please schedule one with your provider to help protect yourself against the flu. Because remember, there's a compounding effect here. If you have cases of flu and COVID-19, that strains resources, and you've got a lot more people that are sick. They say to call your local primary care provider to make sure all your immunizations, including Tdap and pneumococcal, are up to date. Practice healthy habits, get plenty of sleep, don't smoke, drink plenty of fluids, eat nutritious foods, and ensure that you're taking all your medications daily as prescribed by your medical provider. They emphasize again that Cordova medical staff at Elanca and CCMC have been trained to deal with COVID-19, but it really helps if you have any of the symptoms listed above. Please call ahead to speak with the nursing staff. Call in advance of going over there. Now, some general information from our local folks, again, these agencies we mentioned that have been working together, saying, again, their goal is to slow the spread of the virus and prevent significant impacts on our community and availability of health care in Cordova. This document says COVID-19 is a new disease, not specific to race, and the virus is thought to spread through respiratory droplets produced when an infected person coughs or sneezes. It's also possible that someone can contract COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or eyes. But this is not thought to be the main transmission of the virus. This mentions again that if you have a flu-like illness or respiratory symptoms, the increased fever, persistent fever, if it's persistent and is 100.4 or higher, and shortness of breath, please call ahead before coming in. This applies to the emergency room and clinic. They want everybody to know they have protocols in place to triage you prior to being seen in the clinic, and these precautions protect you, the staff, and other patients. Testing for flu and or COVID-19 will be based on protocols provided by local health agencies. Now, our Cordova Prepared and the local agencies have also put out a frequently asked questions document, and again, the lead item on that is that there haven't been any confirmed cases in the community. So going through these FAQs, where can I find current local information on COVID-19? The response is information will be posted on the Cordova Prepared pages, both on Facebook and on the City of Cordova website. And by the way, I want to emphasize this Cordova Prepared Facebook page. If you have access to that, that's a really good thing to subscribe to and keep an eye on, because it's sort of the central, this information that comes from different agencies and is verified as accurate, not being hoax or hype or fake or any of that. They look through this stuff and then they put it on that page, and that's what we're going to be following because, again, it's a good central location for official information release. So that Cordova Prepared Facebook page or Cordova Prepared through the City of Cordova website. Another frequently asked question, can I get tested for COVID-19 in Cordova? The response to that is testing is available in Cordova at Cordova Community Medical Center and the Elanca Health Clinic. Again, the CDC guidelines and criteria for testing will be followed, so please call ahead before coming into the ER or the clinics to allow the staff to prepare. Next question, how do they test for COVID-19? The answer to that is a nasal swab is taken and sent out for testing, and the results take about 5 to 7 days. Another frequently asked question, what do you do while you're waiting for the test results? What will happen is you'll be asked to self-isolate and refrain from going into the community. During this time, you'll need to self-monitor your symptoms and report changes to your medical provider as requested until your test results are available. If you test positive, your medical provider will give you further instructions. Another frequently asked question is, how can the symptoms of COVID-19 be treated? They say there's currently no vaccine, so symptoms will be managed on a case-by-case basis. And then finally, who is providing this information? It's the COVID-19 Response Group, which is a group of providers and responders that have been meeting and planning together regarding the virus since January 23rd. The group consists of representatives from the Cordova Community Medical Center, Elanca Clinic, City of Cordova Emergency Management, local EMS, and the public health nurse. See, gotta love how our folks work together. All planning for the health and safety of Cordova has been a collaborative effort, and they will continue that partnership as the COVID-19 situation develops. Together, they say they'll try to effectively answer questions and concerns from the community, but they ask that everybody understand that COVID-19 and the information surrounding it is constantly evolving and changing as the situation develops. So please keep in mind that the answers to some questions may change as the situation progresses. Now, another asset that's available at the state level, and this is another bit of information that the Cordova Prepared folks shared yesterday, is that the Department of Health and Social Services has enlisted Alaska 211 as a resource for handling the large volume of calls from the public with COVID-19 questions. The 211 information referral specialists are equipped to take and triage these calls and refer callers to appropriate resources. The 211 call center also includes an Alaska Respond volunteer, and these volunteers are licensed medical professionals who can help answer basic health questions. So again, keep that number in mind, 211, if you have any trouble for any reason reaching a local resource, off hours perhaps, or whatever. And then another asset that you can use from DHSS is their website, which is coronavirus.alaska.gov. Something else to have in your quiver in addition to the local official websites and Facebook pages, coronavirus.alaska.gov. Now, we'll move into some specific announcements from local operations that are modifying how they do things. And by the way, we always want to encourage people to send us any information about closures or, if you're doing anything differently, because obviously we'll be happy to get that information out there. One of these is from Cordova Electric Cooperative, which says that they are open and their customer service representative will be available to assist you over the phone, but they're going to keep their front desk closed to customer traffic until further notice for obvious reasons. So you can call them, but just don't come in if you don't mind. And if you need to deposit payments or annual meeting balances or ballots, annual meeting ballots, you can do that in the drop box. And their phone number is 5555. So they are open and operating. They just ask that you not come to the office. Now, starting today, Monday the 16th, some changes at Bidarki. Cordova Parks and Rec Department will adjust the Bidarki Rec Center barcode access to the public, and those changes will allow them to properly disinfect the equipment and surfaces for each of their user groups. Their goal with these changes beginning today is to avoid closure and maintain a reasonable amount of access for everybody. They ask for your patience and a firm commitment to disinfecting all the equipment you touch during your visit. If you feel sick, please stay home. The Parks and Rec Department will continue to monitor their ability to keep facilities safe. If at any time they feel that they're unable to do so, the community will be notified immediately. And of course, we'll help get that information out as well. So here's the changes that go into effect today. Number one, barcode access for members, including active duty Coast Guard and their dependents, that is. Monday through Friday, barcode access will end at 8 p.m. Patrons will need to be out of the building by 8:30 p.m. On Saturday, barcode access ends at 4 p.m. Patrons need to be out by 4:30, and there will be no barcode access on Sundays. Cordova's first responders will not have change in access. They will offer youth open gym from 3 to 6 Monday through Friday. And the gym will not be available to adults. This is just for youth during spring break, 3 to 6 p.m. Monday through Friday. And with the schools being closed through the end of the month, I don't know yet if they'll continue to do that, but we'll let you know once we find out. And then they also say they will offer one additional teen open swim to the current regular pool schedule during spring break. Teen open swim Thursday, 3 to 6 p.m. Otherwise, there aren't changes to the regular pool schedule as of this printing. Now, if that gets updated, obviously we'll let you know. And for adult basketball and volleyball, there aren't any changes to that either at this point. But like they said, and I'm sure it's pretty much common sense, these things can change very quickly. So that's the most current information, but be prepared for the possibility for that to need updating. We're going to go back to the state level here now for just a sec and share information that just came out from the Alaska School Activities Association. ASA Board of Directors, and you know, this has to do obviously with school sports and all of that. Their board has changed the first practice dates, the first contest dates, and the spring championship and event dates to be determined. It's kind of a mouthful, but all of those things will have to be determined start dates. And they've granted the executive director the authority to determine when those dates will be rescheduled. That decision is based on guidance of state health officials, the Alaska Department of Education and Early Development, and the change in the activities calendar goes into effect immediately. So bottom line, what this means is that all ASA activities are to cease for all ASA member schools, both public and private, until allowed to resume by the executive director. And the decision was made as a result of the announcement, you might remember, that came out, I think last Friday, that from March 16th to the 30th, all public schools across the state are to be operating under non-student contact days in which students will not be attending school. So basically, students don't go to school till the end of the month. And during that time, all after-school activities are also suspended. Now, again, if there are any updates on that, if they shorten it or extend it or anything, we'll let you know as soon as we know. Now, finally, something kind of neat here, of course, that is great about Cordova is grassroots efforts. And the Cordova Neighborhood Watch page is doing a really good job of that and focusing on trying to coordinate efforts to help folks that may need some extra assistance, particularly the vulnerable populations, with getting the things that they need. Now, again, this is not official. I want to the Cordova, but because the Cordova Prepared page, the official sort of pipeline for information, mentioned this other page and the efforts that the Neighborhood Watch folks are trying to do, I thought this would be good to bring up. And their concern is seeing that people who really should not be out at all, the elderly, people with compromised immune systems and so forth, can still get the things that they need, like medications, over-the-counter or prescription, food, anything necessary to get through this isolation period, which again is till March 30th. But that could be extended. Now, the Neighborhood Watch people want to emphasize, and I think wisely, that they're not recommending people just run around willy-nilly and do this, but maybe work through them, a sort of a coordinated group, so that the people that need help can get help while having the minimum number of people running around and taking care of that. So they're just basically, they're offering themselves as an asset. And if you have Facebook, that might be another good page to follow, is Cordova Neighborhood Watch, because people, what they've been doing is encouraging people who need help to post that, and then people who are available to provide help can be connected with those folks. Again, without having so many people running around and trying to do things. maybe having a core group of people who can assist with that. So that's a neat idea. And again, it's nothing official, but I thought might be worth bringing up and another good thing to follow. Something else that they posted was an information sheet on social distancing and what it means, and to an extent what it doesn't mean, which we thought might be interesting since that's being recommended. This document says social distancing is the practice of reducing close contact between people to slow the spread of infections or diseases. Social distancing measures include limiting large groups of people coming together, closing buildings, and in some cases canceling events. Now, when social distancing is being recommended, things that, and they break these things down into red, yellow, and green, like on a stoplight, with red being the most severe. So the things to really avoid during a social distancing period are group gatherings, sleepovers, play dates, concerts, theater outings, athletic events, crowded stores, workouts in gyms, visitors to your house, non-essential workers in your house, and mass transit. So those are recommended for complete avoidance. Now, again, this is just a recommendation. This isn't like some official mandate. It's just something to keep in mind if you're looking for guidelines. The yellow items under use caution are visiting a restaurant, going to the grocery store, getting takeout, picking up medications, visiting the library, going to church, and traveling. Then the things that they say are green-lighted, perfectly safe to do: take a walk, go for a hike, do some yard work, play in the yard, clean out your closet, read a good book, listen to music, cook a meal, family game night, go for a drive, group video chat, stream your favorite show, check on a friend, or check on an elderly neighbor. So, sort of gives you a framework for how to think about some of these things. And again, not to feel necessarily like you've got to be completely homebound. If you need to be out getting some fresh air, and but not being in a situation where you can infect anybody or become infected. Again, that's largely anecdotal. It's not anything official. Just some things to think about. And so, with that, we will wrap this up. Thank you for joining us for this town meeting program. We'll continue to use this program and any other announcement-making time slots we have to keep you up to speed, particularly if things change, and we all have to understand the only constant will be change in this situation as things evolve. Big thanks again to Cordova Wireless Communications, CWC and CTC, both very, very good supporters of local radio, which we appreciate. A lot of things we wouldn't be able to do without their help. So thanks to Cordova Wireless specifically for bringing you this show. We'll resume the rest of our regular 10 a.m. hour programming here on KLAM. We wish you all the best. Be safe. Thanks for tuning in.